much for showing all your love and support for my videos that I uploaded before. As promised, we are going to discuss about the DACWR report. That is one of the requirements to send it to NDAEB when you are applying for your eligibility. So let's get started. Perfect. So here on the screen, you can see the report. I'm just going to go quickly over the checklist. That is the $320 as bank draft, the original reports from either ICES, IQS, or WES. Or if you have an NDAEB profile, you can get your eligibility done directly. You have to submit certified true copies of your academic transcripts and diplomas. You have to send them a signed and complete DACWR report, that is dental assisting coursework report. If you are an applicant from dental assisting, hygiene, or any elite dental healthcare programs, you also have to submit a program survey requirement form. A signed consent personal information form is included at the end of this report, which you have to send them. And if there is a proof of name change, you have to support the documents for that. Starting with the form itself, you have to let them know if there is a name change so that they can look for the extra documents that you have sent them. You have to let them know your address, your country code, your postal code, your email address, your telephone number. Once you're done with that, you have to let them know which of the international agency for credential that you have used. I used WES, so I'm going to circle up on that. If you have done with NDAEB, you're just going to let them know that it's just NDAEB. Like I said in my previous video, application will remain as pending until an agency report has been sent or received by NDAEB. Perfect. So let's dive into the report itself. It's a quite long form, but it's easy and it can be done. To begin, the first one is name of the certificate, diploma, or the degree. I did BDS, Bachelor of Dental Science, from back home country, India. Issuing institution, my university or the college name, the date that it was issued, the length of the program. Now for some students, the internship is more, so you just have to take into consideration the whole thing, write down the length. Entrance requirements. So there are some students who got into with the help of NEET, or there are some which just got into some other exams or state-wise exams. You just have to write that here. Now, everything from here to the end of the report is basically asking you all the duties, all the academic things that you have done in all your 4 years. So let's get started with that in this part. When we see it asks here, apply the principles of ethics, including self-reflection of personal competence, legal duties, time management, problem solving, explain treatment to patients, caregivers, or any privacy policies in terms of communication. Our college had all of these in public health dentistry, and it was taught to us in final BDS, and it was in 2019 where I had my final BDS. So if it was taught to you in any other year, you will just change that, and of course you will write down the year that you read them. And I just studied them in public health and nothing else, so I'm just going to put public health here. Now, second one is the dental sciences. You have to check all of these, all of the one which you have read, so that they know that this is what you have done in that particular course of the year. Describe the locate and identify structures of oral cavity, soft tissue landmarks of oral cavity, tooth anatomical landmarks, that's supporting structures, bones of head and neck, landmarks and anatomical landmarks of head, TMJ, muscles of face, oral cavity. You have to tick them all, whichever you have studied, I mean. Oral pathology, describing the generic, developmental, and acquired anomalies, describing the tooth eruption and exfoliation patterns. Microbiology, which discusses about microorganisms in oral cavity. And pharmacology, where it asks about non-prescription, prescription, controlled drugs, and everything. So once you go through this, you just have to go back and think of in which subjects or which course did you learn all of this. So for me, I learned all of the above mentioned in dental anatomy, embryology, and oral histology, which was in my first PDS, and of course the year that I took the course. The other stuff which was asked here was included in general anatomy, embryology, and histology. The pharmacology part was, of course, studied in pharmacology in second year. There were also some questions which, when I recalled, were taught to me in general pathology and microbiology in third year. And of course, oral pathology and microbiology when we're talking about microorganisms, which I studied in third year. You have to write down the year which the course was completed. Now comes the clinical support procedures. You have just make sure they are ticking all the boxes here, which you have done back home. Once I do that, I am gonna just go over everything, identify and operate dental instruments and equipments, apply principles of ergonomics, how to work with the patient in which chair position, explain protocols to reduce biofilm, sanitization, and the other points. Now, all of these, when I go back, I saw that I read them somewhere in oral medicine and radiology. Now, these subjects were taught us both third year and final year, so I put them both here. The other things were taught to me in oral and maxillofacial surgery, of course, which was taught again in third year and final year. Dental materials, which was just taught to it in second year, and there were some points which I remembered that I was studying in general anatomy, and of course the dental anatomy itself, which I studied in first year. Now, patient records, which says applying protocols to comply with the legal requirements of maintaining and transferring patients to another clinic or on paper-based or electronic system. Complete and update patient records using a paper-based and electronic system, which include health history, intraoral documents, extraoral documents, oral hygiene indices, diagnostic models, bite registration, vital signs, relating patient history information to the treatment plan if something is contradicting. Once you narrow down everything, I was taught all of these in oral medicine and radiology, of course in public health dentistry, dental anatomy, embryology, and histology. And when we talk about the impressions or the bite registration, we have taken them in orthodontics, dentofacial, and orthopedics, which again was taught to me in third year and final year. Going to the next part, which says patient care procedures. Some of the portions or the parts are pretty long, and you have to sit down and see which or when are they taught to you. So just make sure you're doing the right thing when you're filling up the form. Explain the rationale for obtaining the vital signs, describe factors that affect vital signs, taking blood pressure, pulse, temperature, etc. Collect diagnostic information, assisting with the diagnostic informations like providing the rationale for the diagnostic procedures to how to do it correctly, in what situations you will do them, and of course getting the preliminary impressions for study models to obtain both mandibular and maxillary preliminary impression following the procedure step. So these steps are very important here. Make sure you go through everything, because this is one of the skill set that is being asked in the CPE, as just here in bold letters, which is mandatory intraoral skills, which is also evaluated on the CPE. Once you take everything in, make sure you read the other parts, which says X-ray machines and their function, how do they work, what are their parts, their history, dental film packets, what is the importance of this. There are many types of dental film that you have to go through. You have to necessarily see if you have been taught about the ALARA principle, because that is one of the requirement, which is like bold, important. Describing the radiographic image, duplicating the procedures, mount, label the radiographic images once you are done. These are important because these are being asked on CPE, so you have to know them. You have to see which year where you guys start about it. Then comes the emergency care, emergency drugs, emergency supplies, emergency situation in a dental setting. Then we have management of patients, scheduling appointments. When we have special needs kids or humans or adults which require more than just usual, So we have to let them know where did we read them. Then comes the anesthesia and the pain management. Identifying precautions during application of topical and administration of local anesthesia. We do it during root canals, doing extractions, and so many other things, of course. Describing signs and symptoms of adverse reactions to anesthetic. Preparing equipment, supplies for topical and local anesthetic administration. Very important thing here: managing needle stick injuries when we are trying to work in a clinic. This is some of the most important things that you should know. Select and prepare equipment and supply for tray. This is one of the mandatory intraoral skills that is required, because this is also one of the skills that you are tested on. Of course, assisting with sedation and general anesthesia. Differentiate between the levels of sedation and general anesthesia. Describing signs and symptoms of adverse reactions to anesthesia and sedation. There are moisture control techniques, like you use cotton rolls, triangle, so many other things that you have used during doing restoration or during your dental dam. So select and prepare equipment, supplies considering the patient's dentation. Apply and remove dental dam following the procedural step. To isolate everything, to evaluate, to provide a pre-operative, operative, and post-operative information to them. This is again also one of the most important one, because this is again checked on your CPE, that is clinical practical evaluation. Rubber dam is one of the skills that you are tested on. Operative dentist procedures: identifying the cavities, which restorations are you doing, assisting with application of treatment liners. Describe the components of bonding system, whether it is two-bond system or everything in one. Apply treatment liners where there is no pulpal involvement. This is one of the important thing again, because applying treatment liner is one of the CP skill again. Make sure you took everything which you have studied, so that there is less time which is wasted when you have applied for your eligibility. Assist with preparation and placement of permanent restorative material. So just make sure you go through everything. I'm just going over everything. I did go through it in detail when I was filling the form, but I'm just giving you an outlook of what you should see and what should be the most important thing when you are writing down. Oral and maxillofacial surgeries, contraindications and state indications of the surgical procedures, performing suture removal. It is not asked on CPE, but it is a very mandatory intraoral skills for them. So make sure you put that in. Endodontic procedures, which of course states the indication and the contraindications of all the endodontic procedures. The periodontic procedures, again, just the same. The prosthodontic procedures, where we have the fixed one and the partial or the removable processes. So all the theory which you have read that. Describe the dental assistant role in coordinating the preparation, packaging, delivery, receiving all the lab cases. It is there in our textbooks. Even if we might have not gone through that, it is there in our textbooks. So just make sure you go through that. When it comes to orthodontic procedures, we have occlusion and malocclusion during the angles classification, malaligned teeth, and everything which is related to orthodontic here that you have done in any of the procedures or while you were assisting just in orthodontist PG. When I narrowed down to everything, I found out that most of the topics I studied were in oral medicine, radiology, periodontics, of course, general medicine, which I was studying in third year, preclinics, conservative dentistry. There are some parts where they were taught to me in preclinics and not the conservative itself. The oral and maxillofacial surgery, conservative dentistry, and endodontics, orthodontics, like for impressions and so on. So you just have to make sure if there is any other subject that you were taught these things, you just have to write them down in these boxes here. And then comes the practice management procedures. Manage and maintain filing, recall, and inventory systems in both paper-based and electronic system. Managing patient appointments, referrals, and consultations. All of these were taught to me in oral medicine and radiology. I couldn't recall anything else that I was studying them, so it's just the one for me. Coming to laboratory procedures, of course, for impressions, trimming the impressions, finishing the models, fabricate appliances, entries, maintaining supplies and instruments. We take impressions in prosthodontics, so that was one of them. I did read about maintaining the supply and instruments in general surgery. And of course, when it comes to trimming and finishing the models, we have mostly done them in orthodontics. Make sure you write down your year which you have been taught those subjects or topics, and then years that the course was completed. Now coming towards the end, that is the preventative procedures. Providing oral hygiene instruction. I would say this is the most important part because in Canada, these areas have been given a lot of importance. So make sure you go through this in detail. Describe the caries process, factors affecting its developmental process, and applying principles of instructions and learning to individual and groups. Evaluate outcomes of oral hygiene instructions, providing feedback and making necessary modification. Provide nutritional counseling to relative of oral health, like their sources, their functions, effects, everything. Perform selective corneal polishing, again one of the most important ones, which is checked on your CPE. Removing stain according to the procedural steps. Differentiate between an intrinsic stain and an extrinsic stain. Etiology of stain, I think we studied that in periodontology if I'm not wrong. Let's see when we go further down there. Applying the anti-cariogenic agents, again one of the most important thing. It is tested on clinical practical evaluation to apply fluoride. It was one of the anti-cariogenic agents. I believe we studied them in public health dentistry and maybe one more, I'm not sure of what, but definitely public health dentistry. Applying fit and fissure sealants, again one of the CPE skills. You have to make sure that you take all of these for everything that you have done in your college, of course. Applies the desensitizing agent. This is not checked on the CPE, but this is one of the mandatory intraoral skills that you might have to do when you are doing assisting. So you get my point, right? Performs tooth whitening using tray. Again, it is one of the mandatory intraoral skills that they require. Like I said, yeah, I did go through those topics in public health dentistry, and sorry for the mistake here. Pediatric and preventive dentistry, oral and maxillofacial surgery, periodontology. So this is the end of the form. I know it was pretty long, but it just takes like half an hour if you are thorough which course you were taught all of these. It's pretty easy. Coming to the end of the form, which is in-office Practicum or externship experience, what you have to do here is you have to say or type down who you are, which university you went to, how many years did you study in your home country. The other thing which is important is you have to give them the length of the course, from which date to end of the course date. For most of the students, you might have got like an internship certificate which shows in which clinical setting you were there from, how many time for. I guess we were there for like a month in oral medicine and radiology and a month and a half for oral surgery. So you have to combine everything and put it up there. You have to let them know what all things you have done in the during your externship. It just says in-office practicum that you completed prior to graduation from your program of study. So you can take the help of that internship program, and then you can write down all the dates that you were in certain departments and the duties that you did there. I know it's a very short space, but try combining everything so that they know what they have worked during your internship. So that's the end of the video. Please let me know if there are any further concerns, doubts, or questions in comments. I can help you out. This form is pretty long, but it is one of the most important form which they take into consideration while coming to eligibility with other documents. So we'll see you in the next video. Guys, have a great day.